This is Frank Sachs. I'm professor of nutrition at the Harvard School of Public Health, and I welcome you to Science News. Today, I'm going to be interviewing Dr. Li from the George Institute in Sydney, Australia, who will be discussing her very interesting and important study on the sodium reduction programs in China. So, Dr. Li, could you introduce yourself and describe the study and its results?
I'm a research fellow at the George Institute for Global Health. When I was conducting the study, I was based in the George Institute China office, and I've hence been transferred to the Sydney office. The study is a cluster randomized controlled trial conducted between May 2011 to October 2012 for 1.5 years duration. The study was conducted in 5 northern provinces, and from each province we had selected 2 counties to participate, and in each of the counties we had 12 townships. And so making a total of 120 townships. From each township, we only selected 1 village to participate as to avoid potential contamination between intervention and control. And the intervention program, they were then randomized into intervention and control groups, equally randomized. And the intervention program received were a combination of 2 components. One is a community-based health education program delivered by the community health educators through a series of interactive health education sessions throughout the intervention period, and poster display, school students contests, and other methods. And the second component of the intervention was providing access to the intervention villages to salt substitute, which is a low sodium added potassium salt. Contains about 65 to 75% of sodium chloride and 15 to 25% of potassium chloride and less than 10% of magnesium sulfate. And in those intervention villages, we further randomized them into 2 groups, with one half of them receiving a price subsidy so that the villagers could purchase salt substitute at the price of usual salt. And the other half would just buy at the normal price for salt substitute, which is double the cost.
So I understand that sodium intake is pretty high in the villages that you studied in China.
Yes, the average sodium intake, salt intake was 14 grams per day, which works out to be around 5 grams of sodium.
I see. So then did your intervention focus on the salt substitute, or did it also include trying to reduce the sodium content in cooking when the families would cook for themselves?
Yes, the health education program actually encouraged the intervention village population to reduce their salt intake generally, and also encouraged them to use salt substitute wherever possible. So it's actually both ways.
I see. So, could you tell us the results?
Yeah, we actually have achieved a 30 millimole reduction of sodium excretion in the intervention villages, and 7 millimole increase of potassium excretion, and the sodium-potassium ratio was 0.9 reduction, and all these results were statistically significant. So this works out like 0.75 grams of salt reduction population-wide.
I see. Now, did the salt reduction come mostly from the salt substitute or from the participants using less salt in their food?
From the results, since we have also got increased potassium intake, and also we have got some process measures suggesting that there's a much larger proportion of participants in the intervention villages who are actually eating salt substitute at home. And also there's findings that those villages receiving a price subsidy were using salt substitute a lot more than those intervention villages without the price subsidy. So these findings in combination with the other reduced sodium, increased potassium would suggest that salt substitute is actually the main drive for the change.
I see. So now to interpret your results, how would you project that this change in sodium-potassium ratio translates to a change in stroke or heart disease.
Yeah, we have actually done some estimate based on the paper published by Bibins Domingo in 2010 in New England Journal of Medicine. And based on their estimate, per 1 gram salt reduction would prevent a range from 1.8 to 2.8% of risk for stroke. And in our study, we have achieved a 3/4 gram reduction in salt, which can be translated in around 30,000 events prevented for stroke in China each year.
Wow, well, that's very impressive.
Yeah, it's only a small risk reduction, but putting it in a large population background, it is actually big.
Exactly. Well, those 30,000 people will be very happy not to have a stroke.
Only if this program can be implemented very countrywide.
Yes. So what do you see as the future in your research?
We actually, since we haven't been able to identify blood pressure reduction in this study, we are actually looking at a larger scale study, still cluster randomized design, and with a longer follow-up period of time, looking at the effects of replacing salt with salt substitute on blood pressure and stroke outcomes.
I see. Well, that's great. Any final comments for the listeners?
Not really. I just like to say that this study may seem like we have only achieved a modest sodium reduction, but putting it in a population like in China or other settings that have similar population where people eat salt, the most salt they consume are from food cooked at home, it would actually have a big impact.
Yes, I agree. I think it's a very fine achievement. It's something that is very rare to find in public health. So congratulations.
Thank you.
And thank you for listening to our Science News.